let's have a chat about injuries. And I guess let's just get straight into it. I'm going to introduce you to 3 types of injury, first of all. The first one is winding, which annoys me as a word because it's the same as winding. I mean, a bit confusing. We're also going to talk about cuts and grazes. Maybe I should have written that in sort of a reddy pink colour. And we're also going to talk about, a really unpleasant one. We're going to talk about blisters. Okay, so let's address these first of all. And I just want to make sure that we understand them. I also want us to think about potential sort of treatments we might have for these. Just think about winding first of all. We know that we might feel winded if we fall. Okay, so it comes from falling. It could come from impact. Okay, it could be with an opponent, for example. I mean, it could also be from being struck in a combat environment. But really what I want to stress here is it comes from landing on one's torso, landing on the torso, that sort of chest area, or the abdomen, okay? Or the, sort of the abdomen, that sort of lower kind of tummy, lower back area. This is what causes winding. Would we all agree? I think we would. Now, in order to treat this thing, let's put the treatments in sort of a minty green colour. What is typically done is we encourage people to put head between legs, okay, as an example, right, to sort of lower, and it sort of seems to ease the pain. And we sort of want people to have a bit of a time out. I don't mean in like a basketball sense. Just take your time, give it a second. I mean, that seems to be the most effective treatment. Head between legs, take a breather, take a moment, recover, and we go from there. Let's have a think about cuts and grazes. Fairly obvious what they are. That was not the right colour, the one I picked. Cuts and grazes, let's have a think about what they are. How are they caused? Well, they're caused by some kind of broken skin. I mean, there's no surprise, is there? The skin breaks, and therefore there's a bit of leakage, really. Now, it can be caused by all kinds of things. What about something like the wrong clothing or equipment? Could be one of the reasons that this could happen. Wrong clothing or equipment, a sharp edge, for example, could cause a cut. But again, it could also come from something like a fall or a collision or these kinds of things. And when we look to treat this, a couple of things that we would look for, Gordon Bennett, we'd look for the cut to be cleaned. Okay, so some kind of sterilized cleansing. And then we'd look for some kind of dressing. Now, obviously with dressing, this could be something as simple as a sticking plaster, but it might be more significant with more significant cuts and grazes. I have heard it argued that grazes should remain exposed to the air. Now with blisters, let's think about this. Blisters are caused by friction. Okay, blisters are caused by friction on the skin. So something is rubbing repeatedly on the skin can experience that friction, and as a result it experiences inflammation, and we get an inflammatory response in the layers of the skin, in the layers of the dermis, and what that does is it creates the blister. Now, in terms of treating these, I guess the classic ones, mountain walking, and you're walking a long way, and your shoes are a bit new, that sort of thing. It could be from, I've had it very commonly. I've played a lot of football in my time. Had it very commonly from football on hard ground, for example. Maybe you've experienced a similar thing. So there's a couple of things that you can do. One of them is to expose to the air. Okay, seems to help. Another one would be the use of a dressing. I mean, that's a pretty classic one, so that if you have to be, let's say, back on your feet again in the near future, you can deal with it that way. I would just add in there, people use things like Vaseline as well for sort of like the smooth, I don't mean to put like brands in or anything, but Vaseline would be one possibility to help that process. Now then, where I want to go with this to finish off with is to really introduce you to a group of injuries which we might ultimately sort of treat the same way. So I want to introduce you to 3. So bruising is the first one. I'm sure you're familiar. Secondly, I want to talk about ligament injuries. And thirdly, I want to talk to you about muscle and tendon injuries. Now, as I said before, in a second, I'm going to suggest one potential treatment which should help at least partially address all of these kind of injuries. But let's just address bruising for a second. By the way, we might call it a contusion, just in case. Let me write it up here for you. I don't think I'm expecting you to remember this word, but contusion is some kind of bruising. It tends to be caused by impact. And what's happening here is there's a small internal bleed. Now, I use the word small they can be much bigger than small. And I am actually personally aware and have witnessed one that was way, way, way worse than that. But on the whole, you're talking about this kind of experience. Now, that's all I'm going to say for now. Ligament. This is ligament damage. Is what we'd also describe as a sprain. That's not the same colour, is it? But also here, it comes from typically some kind of twisting injury. Okay, so twisting an ankle, for example, would be a good example of that. And with muscle and tendon, we're talking here about a strain. That's what we mean by a strain. It means a strained muscle. If it's more significant, it could be something like a tear, and it tends to be damage, not always, but it tends to be damage to the sheath that's around the muscle and the tendon. I'm not going to get into the details of that here, but that is often where the injury actually is. They tend to come from overuse injuries, muscle and tendon injuries generally. I mean, classic example of tendon would be things like tennis elbow, golfer's elbow would be an example. But the other reason they might happen is through not warming up properly. Okay, not warming up, so going straight into a more dynamic or explosive type activity. Now, that's all well and good. Let me get to the pinnacle of what this video is going to be. All three of these, let me do it this way, all three of these, we're going to bring them here, and we're going to say to some extent or to some degree, we can actually treat these the same way. And we can use the R, I, C, E method. Now, it's called the Rice treatment. Now, just be aware, I'm not going to get into it here, but sometimes a P is put in front of these to make a price. I'm not going there, but just so you're aware. Now, the R stands for rest, okay? So when this happens, is rest that part. The I, let me see if I can get the right colour. The I stands for ice. We want to ice it. We want to put that sort of ice to reduce that swelling. We'll often get swelling associated, especially here. Especially, well, to an extent, it can happen here. We want to reduce that swelling. C is for compression. We want to get a nice compressed environment onto that sort of injured part. That helps in a number of ways, especially if you're using ice. And then finally, guys, the E relates to elevation, and it's a very simple idea. By elevating, let's say, the ankle above the level, the altitude actually of the heart, what that means is that we get sort of the kind of the inflammatory response, all that stuff gets sent to the ankle a bit less, and it swells a bit less. So a lot of this is to reduce swelling. Okay, so a lot of this Rice technique is to reduce swelling. It's good that we get an inflammatory response and we get a response to actually the injury, but we don't want it to go to the point where it swells up very dramatically and prevents any kind of mobility and movement of, let's say, that joint or that part of the body. And therefore we try and reduce the swelling. That's why we use ice. That's why we use Rice, rest, ice, compression, elevation. Cheers.